Good evening. My name is Dr. David Doman, and welcome to another edition of House Call. Tonight's topic is gastric balloons, a new therapy to achieve weight loss. Find out more right now. My guests this evening are Dr. Barry and Joseph Green, father and sons practicing together in a bariatric practice here in Montgomery County. Dr. Green, welcome to House Call.
Great to be here. Thanks for having us.
My pleasure. So briefly, Barry, we'll start off with you. Tell our viewers about your professional background.
Well, I started medical school in the University of Miami. I did my residency in Dayton, Ohio in the United States Air Force. I was in the Air Force for a total of 13 years and started a laparoscopic surgery program in Dayton. And then I moved here to the Washington area and continued laparoscopic surgery. I started bariatric surgery in the year 2001, and we've done thousands of patients and helped them lose an enormous amount of weight. And I am now the Director of Bariatric Surgery at Shady Grove Medical Center.
Congratulations, wonderful. And Joseph, you followed in your dad's footsteps.
In a few ways.
Yes.
I was awarded my bachelor's at Emory University and did follow in his footsteps to the University of Miami, where I also went to medical school and pursued a business degree while I was there.
Very nice.
With a concentration in healthcare sector management and policy. Afterwards, I came back to this area to do my residency training at MedStar Washington Hospital Center, and then a fellowship in bariatric surgery and advanced laparoscopic surgery at Innova in Northern Virginia. And since graduating my fellowship, I've joined the practice here in Montgomery County to expand our patients' access to care to bariatric services in Montgomery County.
Wonderful. Well, you both should be very proud. So while I'm chatting with you, Joe, give our viewers a sense of the spectrum, the severity of obesity in our country.
Obesity has reached epidemic proportions in our country, and you can think of it in three groups of people. There are people who are of a normal body weight, that's a BMI less than 25. A third of our population is in this group. Another third are overweight, and their BMI is between 30 and 25. And then there's the folks that are suffering from morbid obesity, and those folks have a BMI over 30. That's another third of our population.
And what does BMI stand for our viewers?
Thank you. BMI is the body mass index. It accounts for our height and our weight, but overall allows us to put patients in groups that represent the amount of health problems that they're going to have relative to their obesity.
Okay. So, Barry, given that there is this obesity epidemic in the USA, is it just a cosmetic issue, or are there healthcare consequences when somebody is overweight?
When people are overweight, it really affects their medical conditions. We call them comorbidities. Like they get higher chance of getting diabetes, high blood pressure, heart disease, sleep apnea, clots in the legs, neurologic issues. So the list goes on and on. Arthritis, gout, all of these diseases are markedly increased in patients that have overweight and obesity. So someone who's even 30 pounds overweight can begin to get diabetes or have a much higher chance of having sudden death.
Very interesting. And I would add to that a higher risk of a variety of cancers. And as you know, I'm a gastroenterologist, and something that's very troubling for us in the GI community is we're seeing colon polyps and even colon cancer developing in younger and younger patients. And the feeling is the national obesity epidemic is contributing to that. So
absolutely,
I certainly agree with your concerns. So, Joe, if somebody is overweight, what are the things that should lead them to think about weight reduction? What are some of the concerns that they should have, and then we'll expand that to some of the options they have to pursue weight loss. So when does somebody have to say to themselves, wait a minute, there's a problem here?
I think any time is a good time to think about our health and our weight. Certainly for folks who are suffering from overweight or obesity and are having health problems related to it, weight management, whether surgically or non-surgically, can be a good way to start improving those health problems. But also, people who are suffering from overweight and obesity who haven't yet developed health problems are at an increased risk of all the things that Dr. Barry just mentioned.
Okay. So Barry, if somebody is considering losing weight, when you get down to it, historically at least, there have been two options. Trying to go on a weight reduction regimen, diet, whether it's on your own or going to a program like Nutrisystem or Weight Watchers, an exercise program on one extreme. And then the other is, of course, surgical intervention, bariatric surgery, which you've covered quite capably years ago on this show. And now, of course, there is the newest player on the block, the gastric balloon. So our viewers are now watching this program and saying, okay, I'm committed to losing weight. Which sort of patient would you say try to lose weight on your own? Which sort of patient do you think needs some sort of intervention at your hand and Joe's? And if they do need intervention, when do you say to them, you're probably a better candidate for the new balloon, and another patient is a better candidate for a bit more complex procedure like bariatric surgery?
Well, since there are really 18 million people in this country that suffer from severe obesity with medical conditions, and there are only 200,000 a year who accept surgery, we realize that the majority of people don't feel themselves that they are ready to have a significant intervention. Many million people have tried diet and exercise, and the studies show, and people's experience are, that they lose only about 8 to 10 pounds on average, and with long-term follow-up, they end up being about the same weight as they were when they started. So really, anyone who is ready to make a change and feels that their medical conditions are bothering them or their quality of life is a problem, they should undergo some intervention. And my philosophy in all of medicine is that we act as consultants, tell people, here's what your options are, and you make the final choice. I think mostly anyone who is over, say, 50 pounds overweight should seriously consider surgical option. But in reality, most patients don't want to do a surgical option. So I believe that...
Why is that, if I can interject?
Well, because I think they're afraid.
Okay.
They're concerned about the risks. The risks are very low compared to the risks of obesity, but even so, everyone has their own idea of what's right for them.
Right.
So I think if someone's 30 pounds overweight, they should really consider the risk of not doing anything, which is significant. And we talked about that before, but decreased quality of life is a very important thing.
Sure.
So when someone's 30 or 40 pounds overweight, I think they should consider a balloon as long as they are ready to change their lifestyle, to exercise, and to diet. Because none of these operations or the balloon are going to make you lose weight. They're really just adjuncts to help a person who struggled with dieting do better and keep that weight off longer.
So is it fair for the viewing public then to look as the balloon therapy as kind of a intermediary step between dieting and bariatric surgery?
I think so.
Okay.
I think that's a really good way to put it.
It fills that niche in between. So if somebody is 50 pounds or more overweight, and you recommend a bypass procedure, some sort of surgical procedure, what do you tell them are reasonable expectations for weight loss, on average?
100 pounds or they could start by saying that a reasonable expectation is 1/3 of their total weight.
Okay.
Average will be about 100 pounds, but certainly if someone is 5 foot and weighs, say, 210 pounds, they're morbidly obese, and that person, I would say, 1/3 of the 210, so it'd be 70 pounds.
Okay.
And that's a good rule of thumb.
All right. And if somebody opts for the balloon, on average, how much weight can they expect to lose?
Well, it's a very good question. It's very interesting. We started doing the balloons about 3 years ago.
Okay.
And so we've put in many of the balloons, and we keep our own data. The national data on average is about 22 pounds, and our average is about 30 pounds. And
Okay.
it may be a little different because of the intensity of our program. So it's not just to put a balloon in and leave you on your own. It's really a weight loss program that does include diet, exercise, coaching, medications when people need that. So it's an entire program of helping people for behavioral modification to lose the weight and keep it off.
What is the most weight you've had a patient lose with the balloon?
60 pounds.
Wow.
We've had 3 people lose over 50 pounds,
Mm-hmm.
but those people all exercised.
Right.
So that's a key
That
component.
they potentiated the benefit.
Yeah.
And what is the least amount of weight anyone lost with the balloon?
None.
None.
We have had people who've had, we've had one person who's lost no weight, and about 20% of the people lose about the same as with diet alone, which is about 5% of their starting weight.
And if I may add, the advantage of keeping our own data is that we can track the robust nature of our program.
Right.
And the balloon has often been criticized by people who think that when the balloon comes out, patients may regain their weight. And in fact, our patients lost their weight and kept it off after the balloon came out. Some even continued to lose weight. And I think that speaks to the lifestyle changes that we've been able to help them make through our program with the nutritional counseling and getting them excited about exercise again.
Yes. So this is really not just the procedure, but also a lifestyle modification. You retrain the patient.
100%. I think it really helps them, especially the patient who's ready for change, as
Yeah.
Dr. Barry said, to come to those new healthy habits.
Okay. And what's the longest you followed a patient after a balloon has been removed?
We try to follow all of our patients. As we said, we began putting them in
Yeah.
3 years ago, and we've got really consistent one-year data, and
Yeah.
that database is growing by the day.
Okay. How do you evaluate somebody? And we have 1 minute left, by the way, before with this answer. How do you evaluate somebody pre-balloon? Do you do any testing, or just set them up for the procedure?
Oh, certainly. We do comprehensive history taking, physical examination, understand their prior struggles with dieting and what their emotional relationship may be with their diet. Our physical examination will often make sure that they are a suitable candidate for the balloon. And if we find anything that we need to look into with further exams or imaging or labs, we can take care of that as well.
And then once you've gone through that preliminary evaluation, what is involved with the balloon itself? Is this something that is done as an outpatient, or are they admitted to the hospital?
It's all done as an outpatient. And I would love to tell you a little more about the ways that we place the balloons.
Well, we'll talk about that next. We're going to pause briefly for a public service announcement. More with Dr. Barry Green and Joseph Green discussing bariatric balloon therapy in a moment. We'll be right back.
We just finished dinner and it was time for homework. He hates homework. I know he's bright.
Why is it so hard for me?
He's
I'm
just
trying
gotta
as
try a
hard
little
as
harder.
I can.
1 in 5 children struggle with learning and attention issues. Go from misunderstanding to understood.org.
We're back. Our topic tonight is bariatric balloon therapy, therapy to assist with weight loss. My guests tonight are Dr. Barry Green and Dr. Joseph Green. Well, Barry and Joe, when we were chatting briefly before, we were discussing balloon therapy. So, Joe, tell our viewers exactly what is it like to receive a balloon. So it's an outpatient procedure, and you do it in the hospital?
Well, I think we should first tease out there are two different styles of balloons.
Okay.
They come in two flavors.
Right.
Some are filled with fluid, and some are filled with gas. The fluid-filled balloons are placed with an endoscope, a flexible camera that goes down into the stomach, and we inflate the balloon with the liquid there. The gas-filled balloon is actually placed in the office, and there's no anesthesia, there's no procedure required. As part of their evaluation beforehand, we have them swallow the balloon, which is wrapped in a vegetarian gelatin capsule.
Right.
But we have them swallow a placebo, a fake one, if you will, just to try and make sure that they're okay to swallow this thing. And when they are, we can go ahead to place the real balloon. And it's done in the office. They swallow a little capsule with the balloon inside of it. It dissolves in their stomach, and we inflate the air using a live motion picture X-ray in the office to make sure that it's in the right place when we inflate it.
So how do you choose each of these options for a patient? When do you choose the water-filled balloon versus the air-filled balloon?
Well, it often comes down to a discussion with our patients, and we tailor the right therapy to the right patient as far as the progression and if they have any lifestyle issues that would make one balloon better or worse than the other. For example, a fluid-filled balloon in an equestrian, someone who rides horses, they might feel that moving around in their belly, as opposed to a gas-filled balloon or an air-filled balloon, which might be a better choice for that patient.
Okay. Is there any comparative data where one balloon is better than the other in terms of losing weight?
Most of the balloons are on par with one another. We're still tracking some of our data to try and compare them because our practice does offer all three of the current balloon options.
And what is the third option? You mentioned...
So there are two balloons that are filled with fluid.
Right.
One is a single balloon.
So two different companies with fluid filled.
That's correct.
Okay.
And one that has two balloons together.
Right. And the other one is one big balloon.
And the other one are three air-filled balloons.
Right, okay. And are they equally safe, the different techniques, in terms of side effects, complications, anything like that?
So we found that the gas-filled balloons are often better tolerated
Really?
than the fluid-filled balloons.
Right.
And it may be for a few reasons. The fluid-filled balloons are put in at one time, so it's a bigger change to the stomach all at once. The three gas-filled balloons are placed not on the same day, but a few weeks apart. And it's our belief that the stomach kind of gets used to them more gradually. But patients come back and tell me more often that they find they are tolerating it, some of the symptoms, as you mentioned, much easier with the gas-filled balloons.
Okay. So Barry, a patient has had one of these balloons placed. Let's say it's one of the water-filled balloons. What can and it's an outpatient procedure, which means when you're done, you're sending them home. So what can they expect that night and the next few days to follow?
So the water-filled balloon, as Joe said, is placed and filled up right away. And so it fills the entire stomach. So the first thing people feel is like they just had a huge meatball dinner. It's just sitting in their stomach. And the water-filled balloons cause some discomfort and some nausea in the majority of patients. So their stomach takes about 3 days to get used to the balloon. And so we tell them to take 3 days off of work.
Okay.
And we give them medicine for pain, medicine for nausea. So even if though it's not surgery, they feel like they've had some procedure for just those 3 days. There's no incisions and very, very low risk, but they do feel this discomfort for 3 days. Well, as Joe said, the air-filled balloons, they can come and have the balloon over their lunch hour and go back to work, and very few people feel anything more than a little cramping at night while their stomach is getting used to it when it lays down, when they lay down. The reason that the balloons work and the reason that they cause discomfort is because the stomach tries to pass the balloon constantly, like it's trying to push food out of the stomach. And I believe that the balloons really work mostly because they are pushed down to the end of the stomach and cause a temporary obstruction of the stomach, so the food really can't leave, and it just causes them to feel like they're full. And then as the stomach dilates, the balloon falls away from the end of the stomach into the higher part of the stomach, and they pass the food. With the air-filled balloons, people can drink water and make the balloons float. So we tell all of our air-filled balloons, the Obalon patients,
Right.
that they should drink water and float the balloons all day long, and that will press the balloons against the top of the stomach and enhance their sense of fullness. And between the two water-filled balloons, the one that's a single balloon called Orbera, that one has more symptoms and slightly more risks than the double-filled, the two balloons that are attached together, because the thought is that if the two balloons are attached together and one of them obstructs the end, the stomach can push the other balloon away, and the symptoms subside. So that's a little better tolerated. All three balloons total about 25 ounces total.
Right.
So it's like you've drank 25 ounces of water and you feel really full.
So, Joe, you've deployed one of these balloons into a patient. How soon after the procedure are you implementing the nutrition counseling and exercise program?
That's a great question, because actually we started beforehand. When I see them in the office, the first thing I tell them is that the rest of their life starts today. And even before we place the balloons, we get them used to picking foods that are healthier, toward understanding the composition of their foods. And we start to talk to them about exercise and its importance in maintaining a healthy weight and a healthy life.
And Barry, you have a patient who's been successfully deployed with the balloon. They've been wonderfully compliant. They've tolerated the technology. They've been exercising, changed their diet. They've lost, I'll say, 35 pounds, a very good average response. And now it's 6 months, and you are going to broach the subject of removing it. What do you do with the patient who says, no, I'm doing great, don't rock the boat?
That's a really tough question. And we've had a couple of people. The complications related to the balloons are long-term. They can erode through the stomach and cause what's called perforation, where the stomach just breaks open from the balloon. And the studies on thousands of people show that this is a very rare occurrence, but it increases as the balloon has been in for more time. So the FDA is currently, from the companies, currently looking at keeping it longer than 6 months. But right now the risks are are thought to be high. And so we tell the patients that if they keep it longer, they're risking an emergency, and we recommend that they take it out. The other complication, in addition to perforating the stomach, is that the balloon deflates spontaneously. And with both of the water-filled balloons, if they deflate spontaneously, they'll obstruct the stomach and require surgery to get them out. While with the air-filled balloon, if it deflates, it'll just pass on through like a piece of food that wasn't chewed. So that's not a major issue, but it can be a major issue for some of the balloons.
Sure. And Joe, besides perforation, I do know there have been some rare case reports of other complications with the balloons. What are some of those rare complications?
So in your field in gastroenterology, you're very experienced in treating pancreatitis. And in some cases, particularly with the fluid-filled balloons, because the pancreas lives behind our stomach in our abdomen, if the balloon is sitting there for too long and pressing up against it, it can irritate the pancreas, causing a case of pancreatitis.
Now, there have been some extremely rare cases of sudden death as well. Has there been any illumination provided by the FDA about what happened?
It should be noted that all of those cases were also in water-filled balloons. Recommend the gas-filled balloons because of the better side effect profile and a lower complication rate.
Yeah. And Barry, I'm sure our viewers are wondering, given that obesity-related diabetes or hypertension or high cholesterol is benefited with this wonderful technology, what kind of insurance coverage is available for it?
Well, sadly, insurances consider the balloons experimental.
If I could interject, why is that if it's FDA approved?
It's a sad story in our country, but the insurance companies can make rules that are not consistent with what the FDA finds or consistent with research. The balloons are clearly not experimental, but the insurance companies just make their own rules. And unfortunately, they don't pay for any of the balloons, and they don't pay for any person who has a BMI of less than 30 to have any procedure, and I'm sorry, BMI less than 35 for any procedure, although we're hoping that's going to change. Mm-hmm. But anyway, they're not covered by insurance. They cost about under $8,000, depending on the balloon and clinical situations.
So that $8,000 covers everything, or the initial balloon deployment? What does that cover?
That covers.
Because our viewers are going to wonder.
Very good question. Thank you. The $8,000 covers the balloon. It covers the insertion, a whole year of follow-up and nutritional counseling and exercise training, as well as removing the balloons. So for an entire year, everything is covered.
Okay, so it's a complete program.
Complete program.
All right. So, Joe, in our closing minute, if our viewers have any questions about balloon endoscopy for weight loss, how can they reach you?
Most certainly. Our website, www.marylandbariatrics.com, is a great resource, and we have information on all the balloons that people can read, and they can make appointments with us, and they can come on into the office and give us, we would be happy to see them for a consultation.
Great. Well, thank you both for joining us this evening on House Call.
Thank you.
Appreciate it.
My thanks to Dr. Barry Green and Joseph Green for a very informative discussion about balloon procedure to assist with weight loss. My thanks to my terrific team here at the studio for making House Call the success it has become. But most important, thank you to you, the viewer, for welcoming us into your home. Tell us how we're doing. You can reach me at my practice website, montgomerygastro.com. See you then next time for another edition of House Call. Good evening.